You may be watching this film because you want to know more about dementia, or because you or someone you care about has recently been diagnosed with dementia. In this film, we hope to help you understand more about this condition, how it can affect a person and their family. You will see ways of coping with some of the difficulties and find out what help is available for you. We will also meet people who have been diagnosed with dementia themselves or care for a family member with dementia and talk to them about their experiences. What is dementia? Dementia is a condition arising due to changes in the brain. These changes can be caused by a number of different diseases. Dementia leads to a progressive decline in a person's memory, thinking and behaviour. Married for 41 years, this carer met her husband in India. Her husband was a businessman who later bought his own shop, which was a newsagent, post office and grocery store. Her husband suffers from Parkinson's and Parkinson's dementia. He has been suffering from Parkinson's for 13 years, and he was diagnosed 9 years ago. The dementia began in 2011, and they found out in the hospital that his memory was deteriorating. Dementia can have a variety of symptoms. The most common symptom of dementia is a decline in memory, especially of recent events. Gradually, her husband began to forget things. He would have accidents in the bathroom. He'd forget to turn off the lights or turn off the water. This was quite a frustrating time as they could not understand why he was doing this. When they would ask him about it, her husband would deny everything. He would forget to go to the bathroom or would forget where the bathroom was in the house. He would wander through the rooms looking for the bathroom. If he wanted to go down to the bathroom, he would go upstairs, even though they'd had one built downstairs especially for him. Making conversation may become more difficult. The person may struggle to remember the right words or repeat the same thing over and over. Mood and personality could change. For example, they may become even more irritable, sad, and become very angry very quickly or even suspicious. Items are often misplaced or everyday items are frequently lost. For example, their keys, purses, etc.
मेरा नाम मोहब्बत खान है.
Mr. Mohabbat Khan came to England from Pakistan in 1960. There used to be a time when he would interview English people. Now he's forgotten how to speak English. He used to speak Bengali fluently, and now he's forgotten it completely. Sometimes he forgets the names of his own grandchildren. It has been almost 5 years since her father was first diagnosed with dementia. Before that, for nearly a year or two, or maybe even longer than that, they didn't realise what was happening. He would get angry very quickly, and many times he would be unable to remember things. He has only one grandson, but when he went to the school, he could not remember his name or his age. His grandson had a doctor's appointment. He remembered the appointment but completely forgot his grandson's name. After that, they slowly realised that he was forgetting things very frequently. Since the day of his stroke, he forgets things. Sometimes he can't remember the names of the children. He lost his car keys and had to pay £100 to get them replaced. After that, he lost his glasses 2 or 3 times along with other things. He has even lost money because he struggles to remember where he's put it, and all of this is beginning to become difficult. As dementia progresses, confusion can increase. They may have difficulty remembering where they are or what year it is. They may think others are stealing their things. Sometimes they may find it difficult to recognise friends and family. As dementia progresses, the person may become more physically frail. They will find self-care more difficult and may need help with things like washing, mobility, and dressing themselves. What is the difference between dementia and ageing? Earlier, they knew nothing about dementia. They had heard that there were some people who suffered from dementia, but had no experience of dementia themselves. No one in their family had ever suffered from dementia. In India, people believe that you become forgetful in old age. As they too were getting to that age, they thought maybe that's what it was. Some people believe that dementia and old age are the same, but that is not accurate. Although ageing can cause some memory changes, the changes that occur with dementia are much more serious. Problems like forgetting, losing things, etc. increase so much that they start to affect everyday life. Others around the person can become worried and they begin to notice the problems are worsening. Types of dementia.
Alzheimer's disease में
Alzheimer's disease is caused by abnormal proteins that get deposited in the brain, resulting in the destruction of brain cells. The memory chemical acetylcholine is reduced. The brain also begins to decrease in size and starts to shrink. This is a picture of a normal brain. Here you can see how Alzheimer's disease affects the brain. Vascular dementia is a different type of dementia, in which the blood flow to the brain is decreased due to the disease of the blood vessels. It can also be the result of a stroke. High blood pressure, high cholesterol, diabetes and smoking can also increase the risk of vascular dementia.
लोग अक्सर समझते हैं कि
There are many different types of dementia. People often think Alzheimer's and dementia are the same, but Alzheimer's is actually one type of dementia in which the most significant symptom is memory loss that begins and progresses very slowly. Vascular dementia is another type which can have a more sudden onset and can progress more rapidly. Apart from these, there are a number of other dementias such as frontal temporal lobe dementia, which causes changes in the person's mood and personality. Other types include Lewy body dementia, Parkinson's disease, etc. Treatments for dementia. Alzheimer's disease cannot be cured with medication, but there is research going on worldwide to find a cure for Alzheimer's. There are some medications which can slow down the progression of dementia if taken in the early stages. That is why timely treatment of dementia is really important. In vascular dementia, it's very important to keep blood sugar, blood pressure and cholesterol levels in control. Apart from this, there's no medication for vascular dementia. If a person also has depression alongside the dementia, then antidepressants can be prescribed. If you or your carer feel very upset and stressed about the diagnosis and you feel unable to cope with the situation, you may find it helpful to talk to your psychologist or ADMIL nurse. A psychologist may also be able to help you deal with the emotions in the early stages of dementia. As the dementia progresses, the behavioural changes that can be associated with it, such as sudden outbursts of anger, screaming and shouting, can be a struggle for families to manage. Psychologists can also help you find ways of managing these. In addition, there are memory management programs where you can learn ways of handling memory problems. Cognitive stimulation therapy is a well-researched treatment technique where you learn ways to keep the brain active. You can also get help from your occupational therapist, ADMIL nurse, art therapist, carer support groups, etc. But for all this, it is important for the dementia to be diagnosed as soon as possible. If you are worried about someone's declining memory, then speak to your GP. Your GP may refer you to a specialist mental health service where you can receive appropriate tests and assessments to find out if you may have dementia. You will also be able to receive support from other professionals, such as a senior nurse practitioner from a memory assessment service. Such services can be found all over the United Kingdom. After the diagnosis. Being told you or a loved one has dementia can be difficult. Many people experience feelings of anxiety, worry, or sadness. It is normal to have such reactions in the early stages. It was very difficult to deal with and to explain it to the children. But because both of her children were grown up, they were very supportive. It's very difficult for a family, but you have to come to terms with it. Social life really ended. She used to look after her husband 24 hours a day. Even now, he is in a nursing home. She had never even imagined that he would ever go into a nursing home. She wanted to look after him and even brought him home from the hospital for 3 weeks. But then he fell ill again and even the carers could not handle him, and so things became very difficult. They then decided as a family that it was time for him to go into a nursing home. She visits him there every day from morning to evening. However, people may also feel some relief after a diagnosis because they feel they can now understand what is happening and why. So a timely diagnosis can have many benefits. One decision that you will need to make soon after receiving a diagnosis is whom you want to inform. Other people feel reluctant to share the news about the diagnosis. Others feel that talking about it openly brings them relief. They find it helps them to know that they are not alone. It is important to talk about and share your worries with at least a few people you can trust. Talking to professionals about the diagnosis and possible treatments available can help. Talking to your loved ones can help you think about and make plans for the future. It is helpful to start thinking about your future care and treatment as soon as you receive a diagnosis, because it will become harder to make these decisions as the dementia progresses. It is also helpful to begin sorting out financial and property matters, make your will and so on soon after receiving the diagnosis. Family members and other trusted people can help and support you with this.
मेरे 4
They
पोतियां
have
हैं
4 granddaughters, 9 years old, 4 years old, 3 years old and 1.5 years old. The 9-year-old understands. When she was very little, she would hold her granddad's hand, help him to sit down. She understood that Grandpa wasn't very well and used to look after him. All the children love him very much. So in a family, if the young children are also involved and they can read a story or show pictures, then this also can be helpful. It is very important to include children in the family and tell them what is happening. There are many books written especially for children which will help them understand dementia and ways to cope with it. Dementia can sometimes give rise to behaviours that carers might find difficult to deal with, such as becoming repetitive or very insistent on their own view.
उस तरीके ने कई गल्लां बेके बिल्कुल नहीं याद
Sometimes her father will completely forget things, and other times he can become very insistent that he went somewhere or said something when that never actually happened. Once she asked her father where he was. He told her that he had gone to the neighbour's house. When the neighbours were asked, they told her that he had never gone to theirs at all. It turned out later that he had actually gone to the doctor's. There have been many, many small incidences like that. As a family, they were becoming very confused.
डिमेंशिया की वजह से लोग कई बार
Dementia can sometimes make the person confused about things like where they are or what year it is. Despite you reminding them many times, they may insist on their own belief. This can be frustrating or annoying for carers, but it is very important not to become irritable or show anger. If someone starts to insist, for example, that this is currently 1960, or that they are now in India or Pakistan, then do remind them, but don't let this turn into an argument. If they do not agree, even after you have reminded them, then you could just try to gently change the topic. Sometimes the person may become very dependent on their carers. They may constantly keep calling out to them or want them to be around at all times. Try to remember that the person is not doing this deliberately to annoy you, but because of their own insecurity and decreasing confidence. Try to understand the feelings that might underlie their behaviour. Provide reassurance when needed. Remind your loved one that he or she is still as important to you as always. Help them feel safe and that you will not abandon them. Sometimes people with dementia can start to feel they are losing control over their own life. Help the person feel in control. Provide choices wherever possible. Try not to make all the decisions for them. Encourage them to participate in making decisions. If the person becomes very upset or distressed, try to distract them with calming activities. For example, playing their favourite music or song, a gentle hand massage, painting, things like that. If you find yourself getting very upset by a behaviour, give yourself some time to calm down. It may be better to briefly leave the room for a while and return when you feel calmer. Try to remind yourself that the behaviour is not deliberate, but due to an illness. If the difficulties such as aggression or shouting increase so much that you feel unable to cope, seek advice from your doctor, psychologist or nurse. If incontinence becomes a problem, speak to your doctor or GP. They will be able to prescribe incontinence pads. Help for carers. If you are caring for someone with dementia, this will also have an impact on you and your relationship with him or her. You will need time to come to terms with your own grief about the loss of the old relationship and the changes you see in your loved one. In addition, you will also have added responsibilities for day-to-day care, which may sometimes lead to feelings of exhaustion or stress. You may on this journey have to start learning to do things that you've never needed to do before. For example, if a wife does all the cooking in a household, after being diagnosed with dementia, they may find this difficult, and so their husband will need to help with the cooking. If the husband always handled all the bills in the house, the wife may have to learn to manage these matters. It is very easy to forget your own needs in this situation. Please try not to let this happen. Please do remember that it is as important to look after yourself as it is to look after others. Express your own feelings and needs and do not hesitate to ask for help.
मेरे friends बहुत support करते
Her
थे.
friends supported her a lot. Then in 2011, when they were in hospital, they met the DISC representative who offered a great deal of support. They do home visits and helped with contacting social services, etc.
मैं dementia advisor.
Tirith is a dementia advisor. She works for DISC, Dementia Information and Support for Carers. They work to support carers of people with dementia or people who are worried about a family member's declining memory. They support them in various ways. When they first receive a referral, they visit them at home to carry out an assessment to identify their needs. If they need a referral to a day centre, this also can be organised. An early diagnosis can be beneficial for the person with dementia as well as their family. If a person knows they have been diagnosed, they can make plans for the future about what kind of services they want. Family members can also understand more about dementia. They can attend dementia awareness sessions and can learn ways of coping with the behaviours. If they want help from social services, this is also available. DISC are a culturally sensitive organisation. They support all cultures like Afro-Caribbean, English and Asian. As a carer, you are also entitled to a carer's assessment from the local authority, who can then put in place any services that are needed.
हम कई बार mental health services में
Within the mental health services, we often find that people sometimes hesitate to make use of the services that are available. For example, some people from the Asian community will occasionally mention that they do not want any services because they feel that the family should take all responsibility or they're worried about what other people will think if they attend services. This kind of thinking makes them reject services, and then the problems worsen, and family members are put under a great deal of stress. It is really important to change this attitude within our community. Dementia, as we know, can happen to anyone.
हमारी एशियन कम्युनिटी में लोग बात
In the
नहीं
Asian
करते।
community, people do not talk about dementia because they think people will say, this person has become mad, and will stop talking to them. Actually, the more we can talk to each other, the better it would be. Not just for support, even the person who is suffering needs support. We need to help the person feel that we are here for them, that they are still the same person, that they've not changed. They forget things, but that is not their fault. The more support you can get, the better. People sometimes think that if they send their loved ones to a day centre, others will say they could not look after them at home. But that is not the way to look at it. There are many advantages of attending a day centre. The person does not remain isolated at home. Also, the family can get a break when they go out to work. They don't have to worry that the person is alone at home. There are various activities at the day centre which helps their mind get stimulation. Dementia patients also get an opportunity to go out of the house. A suggestion was made for them to attend a DISC meeting on Thursday. In the beginning, they did not want to go. She was worried about what the other people would be like and if they were really ill. How would this affect her husband? But one day she thought to try and see what it was like. Over there they met many carers. There were some patients as well. All the carers were really nice, and after speaking to them, they realised that they were not the only ones who were suffering. Others are suffering as well, and they understand what they're going through.
सबसे बड़ा फायदा
The biggest advantage has been that his awareness, friendships and networks have grown. Little by little he was taught things and questioned. The helpful thing about this was that those moments were good for him. After that he would go there for an hour or two. Sometimes he would forget things, other times he'd be able to remember. Even if not 100%, he feels he's improved by at least 60%. Dementia is on the increase and can happen to anyone. You need support and help in this situation. Although there is no cure for dementia, the right professional services can greatly help you manage the dementia.
मेरी mother-in-law
Her mother-in-law goes to a day centre. After that she goes swimming and takes a walk to keep herself healthy. Then she does all the housework. By the time her mother-in-law returns, she's finished all her work. This way she's happy and her mother-in-law is happy too. DISC holds a carers group for carers like herself every week. She attends that, talks to other people, makes friends, which gives her a chance to relax. By attending, she also realised that they are not alone. There's others like them too. Together, by sharing things, they can reduce the burden. Dementia services are confidential and professionals will not discuss anything about you within your community. Get advice about how to deal with these difficulties. Participate in your local carers support groups. They can offer you invaluable support and information. As a carer, you may also be entitled to benefits. Call the Benefits Advice Helpline. The Alzheimer's Society National Dementia Helpline can also offer you advice and support. These numbers will be available at the end of this film. Being a carer does not mean that you necessarily have to do everything alone. Ask for help when you need it, from your family, friends, your community and from professionals. Don't forget to look after yourself. If you feel you need a break or respite, this can also be arranged. Look after your physical and emotional health. Living well with dementia. Looking after your physical health is very important if you have dementia. A healthy diet, low in fats and sugar, can be beneficial. Have lots of fruits, vegetables and fibre. Regular exercise is very beneficial in all stages of dementia. Exercise will help you not just physically but also mentally and can have a positive effect on your memory, mood and sleep. get regular checkups for your sight, teeth and hearing. Also attend your GP surgery to test your blood pressure, cholesterol and sugar levels. Help the person with dementia to do things independently as much as possible. There are a number of devices that can be helpful with dementia. Aids to help memory such as calendar clocks, medication prompts, diaries etc. can reduce the burden somewhat. Locator devices can help you find misplaced everyday items such as keys etc. You may sometimes find it hard to maintain your balance while walking or getting up. There are a number of aids which can be fitted around the house to reduce the risk of falls. Occupational therapists can help you with this. Ask your GP if you can be referred for this. Alzheimer's Society may be able to provide you with more information.
जो dementia advisor service है वो जिन लोगों
Majid
में
and the Alzheimer's Society can provide support. The Dementia Advisor Service works with people who've been diagnosed, and they automatically meet and discuss things with them. They explain that this is an illness of the brain and why it is very important to use their brain. They explain where the clubs are in the local area and how they can use them. They can also explain what benefits you may be entitled to. Driving. After receiving a diagnosis of dementia, it is also extremely important to think about your driving. As soon as you receive a diagnosis, it is vital that you inform the DVLA and your car insurance company about this. Having dementia does not necessarily mean that you will have to stop driving immediately. This will depend on whether you are able to drive safely or not. When the dementia progresses, then you will need to stop driving. The DVLA can carry out appropriate assessments and advise you on whether you are able to drive safely. Please do remember that it is your legal responsibility to inform the DVLA about your diagnosis.
ठीक होना या ना होना या ये
Whether
तो
he
खुदा
gets
के
cured or not, he feels that this is God's decision. But for his part, he tries his best. Such is life. Most of all, it is his 2 daughters who look after him or his younger son. Without the support of his family, he does not think he would be sitting here today. Encourage the person with dementia to do things as independently as possible. This will help maintain the person's confidence and skills for longer. Involve them in family conversations and activities.
Dementia में physical
Staying active, both physically and mentally, is very important in dementia. People with dementia can very easily become lonely, which greatly increases the chances of depression. Family members can offer a great deal of help in this regard. Try to involve your loved ones in family activities. Help them socialise and go out. But please do remember it's important to offer this encouragement gently. They should not feel they have been pressured or forced into a situation. Organise activities that they will enjoy. Simply suggest to them that they try things out when you plan a new activity.
My mother-in-law ਦੇ ਨਾਲ ਹਮਾਰਾ
She has a very good relationship with her mother-in-law. They sit at home and watch video films of their children and laugh. She's very happy doing this and enjoys it very much. Her mother-in-law has had dementia for 7 years, vascular dementia. Due to the dementia, she has no motivation, but she encourages her a lot. She sits with her and they make jigsaws together, build Lego, they do knitting and colouring. When she gets tired, her daughter-in-law massages her hands, which helps her relax. When the weather is nice, they go into the garden. The daughter-in-law has grown vegetables in the garden. She shows these to her mother-in-law and asks her what they are, and she's quite happy doing this. At the same time, she gets some exercise as she takes a walk, and it's also good for her memory. They have a very happy time together. Although dementia will bring changes to your life, your loved one will remain the same person he or she always was. You may have to start doing things differently, but you should not feel that everything or all activities will have to stop. With a little adjustment, you can continue to do things that you enjoy, participate in activities, and experience happiness throughout your life. Do continue to go out and meet people. Your friends and family will offer invaluable support. We hope this film has helped you and enabled you to understand more about dementia. Our most important aim is to let you know that you are not alone. There is lots of help available for you and your family to support you at every step of your journey.